All right, guys, let's get busy talking about our disorders of somatization and hypochondriasis. We're going to start by talking about somatic symptom disorder, and this is going to be characterized by greater than or equal to one somatic symptom. Somatic symptoms could include things like abdominal pain, chest pain, or joint pain with no medical explanation whatsoever. So these patients have been worked up, and there really is no medical explanation for why they are experiencing this somatic pain or this somatic discomfort or sensation. So they often undergo numerous expensive medical diagnostic tests and procedures. So these patients get the full 9 yards, the full workup, and they still have no reasonable medical explanation for these symptoms. And this happens chronically, so it's months to years. This is a chronic problem. This patient is going to be complaining of the same chest pain, of the same stomach pain for months on end with no explanation. This is also associated with preoccupation and stress about their symptoms. So they really ruminate on why and how and the character of the pain that they're having. Now, in terms of management, this is probably the most high yield point of somatic symptom disorder, is that these patients need frequent follow-up with the same provider. I'm going to actually highlight this over again in orange because it is so important. That is almost always going to be the answer on test day. You want to choose frequent follow-up, same provider, because this is what they are looking for you to choose on test day. Let's move on to talk about conversion disorder, which is also called functional neurologic symptom disorder. And I want to set the stage for you guys here. So the vignette or the history for this is going to be a patient who is in the setting of intense stress. So think like a victim of domestic abuse, someone who just recently experienced something life-threatening or a really, really intense life stressor. This is going to be in the vignette of someone with conversion disorder. Now, what exactly is conversion disorder? It's a loss of critical senses or function. What are some examples of losses of that? Well, things like losing your sight, losing your speech, or losing your motor skill. And this is without explainable cause. So these patients are just presenting in a time of intense stress, and all of a sudden they're like, I can't speak. Well, I'm speaking to you guys, but they wouldn't be able to talk, or they might not be able to move their legs, and there's no explanation for this. This is more common in women and adolescents, and it's often accompanied by something really interesting called la belle indifference. And this basically stands for beautiful indifference. And these patients don't really seem concerned or worried about the fact that they've lost their sight or they've lost their ability to move their legs. They're just like, well, whatever, I'm okay with it. And this is probably a product of the fact that they're under such intense stress that they're not really processing things correctly. And this is what leads to this really interesting exam finding. Lastly, let's move on to talk about illness anxiety disorder. And this is patients who are preoccupied with concern or fear that they have some sort of underlying medical condition. So some type of medical illness, it can be anything from high blood pressure to irritable bowel syndrome, you name it. It could even be something that they make up themselves. And this is accompanied by a medical workup that shows no underlying pathology. So these people check out. They have normal vital signs, they have normal labs, they have normal physical exam, they've even sometimes undergone repeat examinations and everything comes out okay. Despite this reassurance, they're gonna still be concerned that they have something wrong with them. You can often see them doing behaviors such as checking their temperature, checking their blood pressure, or self-exams because they really are concerned that something is wrong with them. An important differentiating factor here from our somatic symptom disorder is that somatic symptoms may be absent. So someone with somatic symptom disorder may be complaining of chest pain. They'd be like, oh, I've had chest pain for months and years, and there's no explanation for it. Whereas someone with illness anxiety disorder has absence of somatic symptoms. So they're like, I think I have cardiovascular disease. They don't have any chest pain, but they're concerned that they have cardiovascular disease. They're always going to be checking their blood pressure, and they're like, their blood pressure is normal, everything is normal, their lipid panel is normal, but they're still concerned they have cardiovascular disease, and they are not exhibiting any somatic symptoms. And that is a key differentiator here between somatic symptom disorder and from illness anxiety disorder. Now, the management of both of these is going to be the same. It's going to be follow-up with the same provider as needed. So you always want to have that same provider checking in and kind of saying, hey, I think you're actually okay. We did some tests. Everything's great. That way it kind of avoids unnecessary testing and like further medical workups with new providers every time. In terms of our differential diagnosis that can present similarly to these diseases we talked about, we have OCD, which is usually more characterized by obsessions followed with compulsions. So you could see elements of OCD in someone with illness anxiety disorder who may want to check their blood pressure every 5 minutes, but usually it'll be more specific in a vignette towards a specific illness rather than OCD, which tends to be things like locking doors and washing hands. So they're slightly different in that way. Also, we have delusional disorder, which is a disorder characterized by fixed delusions that are usually related to things like someone's wife cheating on them or their boss spying on them at work, and it may not necessarily be health related. We also have paranoid personality disorder, but these patients tend to be globally paranoid or concerned about a number of things, whereas in these patients that we talked about on this slide, they tend to have very specific concerns about medical conditions or somatic symptoms, whereas people with paranoid personality disorder are globally paranoid about many, many